Hi, I just received a call from the ER. So the doctor want me to put the patient on a simple mask. So the doctor recommended to hook the patient in a simple mask at 4 liters. So when I arrive, before that is I always make sure I assess the patient, and then once I'm done, I have to make sure that the flow coming out, there's adequate flow coming out from the simple mask, and then I'm gonna hook it to the patient, make sure it's being loosened up for putting up to the patient, and then make sure you're able to tighten it, there's no leaks, like that. So after that, I did my vital signs and then make sure I observe the SpO2. And then in a few minutes, I already obtained an arterial blood gas to that patient. And then prior to hooking up to the patient with a simple mask, I observed immediately that the SpO2 level of the patient was about 86 to 89% before putting up the simple mask. And then when the ABG came out, I observed that the patient's CO2 level was too high. And then I also checked on the patient's chart that the patient previously or is being admitted with chronic CO2 retention or chronic hypercapnia. So I immediately ran to the ER, and then I immediately recommended or bring this one with me, the inventory mask, because besides the patients being CO2 retention already, chronic, and then being put up with a simple mask, it might continue the patient to be having CO2 retention. So just to prevent that, I immediately replace it with a Venturi mask, because with a Venturi mask, we always have to give it with a precise FiO2 regardless of the flow. And then I recommended in giving flow of about 28%. So make sure that I'm gonna loosen the attachments, and then make sure we fill it with our hands if there's air coming out, and then immediately put it to the patients. So with this, make sure that there's no any obstructions, especially on this one, and then make sure that the device no longer kink, especially that tubing. And then after that, in a few minutes while being put up on this, I also observed that after putting up with a Venturi mask, the SpO2 level of the patient, instead from 86 to 89, it immediately reaches about 92 to 93%. So I also noticed the patient to no longer be cyanotic, and after that I immediately do my post-vital signs. And then after doing my post-vital signs, I also recommended it to the physician to try to obtain an ABG. After about 15 minutes, try to check if the CO2 level of the patient was just, even though it's high, but at least it drops. So once everything's done, after doing the post-vital signs, I also have to wash my hands, and then make sure everything that I am trying to do with the patient, pre and post, I also have to make sure that I always document and put it to the patient's chart.